Welcome to this Whole Life Action Hour. I am Ocean Robbins, your host. Thrilled to be here to talk with you about being selfish, critical pillars of lifestyle medicine with Dr. Columbus Batiste. And we're going to be looking together at evidence-based strategies for coping with disease and anxiety and stress, and how to cultivate a more meaningful, more balanced, and more healthy life so you can have more joy and more wellness from the inside out. This is a project of Whole Life Club, Food Revolution Network's ongoing membership community, and some of the questions I bring today will come from our Whole Life Club members. Nothing you hear is medical advice here. We're offering coaching and our own best insights, but of course, always consult with a qualified healthcare professional regarding your specific healthcare realities and needs. Now, we're here today with Dr. Columbus Batiste. He's a board-certified interventional cardiologist, assistant clinical professor, and regional chief of cardiology for Southern California's Permanente Medical Group. Dr. Batiste aims to provide long-term solutions for chronic diseases by focusing on nutrition, stress reduction, and exercise. He has spearheaded a groundbreaking virtual cardiac rehabilitation program in collaboration with Samsung Technologies that is benefiting over 15,000 patients right now. He is recognizing the connection between individual health and community, and as such, he is the co-founder of the nonprofit organization Healthy Heart Nation, and their mission is to address disparities in education, business, justice, and health, known as the social determinants of health. Dr. Batiste is sought after internationally as a speaker on the transformative impact of whole foods plant-based nutrition, and he is the author, I can say this now, of his brand new book, Selfish, A Cure for a Stressed and Broken Heart. And as you're about to hear today, selfish is indeed an acronym. We'll be talking more about it, though, the value of self-care. Dr. Batiste, welcome.
Thank you so much. It's such a pleasure to see you and to be here on this platform, too, as well.
All right. Well, your book's just out. Let's talk about that right off the bat here. What is selfish and why is it important?
I love it. I love it. Yeah. So selfish is really, it's the compilation of really kind of peering into my conversations with my patients over the past 10 to 15 plus years. And really it entails an all-encompassing approach towards reducing stress and healing the heart. So one of the things I really uncovered is that as I started and I found the value of really adopting a whole food plant-based diet as a therapeutic intervention, I realized that there are so many other aspects to it. And this is how the pillars of selfish really evolved, based off of research, based off of my own life experiences. And that's what the book is about, is talking about how selfish the components, the pillars, can help heal stress and a broken heart.
So what are the pillars?
Yeah. So the first S stands for spiritual. And so when we look at the Latin root of spiritual, that's spiritus, which comes from breath. And so we learn quickly about the understanding the power of breathing, that many of us don't stop and take deep breaths, and the how that offsets the stress hormone cascade. That's right. That nice. And so when we exhale, it activates our parasympathetic tone that helps decrease and relax our vessels and that tend and befriend. But it's not just the breathing, it's also the mental, the mindfulness, the meditation, the prayer, and we start to understand that there is a science behind it. So irrespective of one's belief system, we understand that when you engage in this, you actually strengthen your prefrontal cortex, which is where you reason. It's right behind this big noggin right here. Mm-hmm. And so you start to reason, and this is where it thickens like a muscle. And this is one of the core foundational principles towards behavioral change and shifting. And so that's why it's one of the key pillars. And what's so interesting is there actually have been studies that have demonstrated that by engaging in mindfulness, meditation, and prayer, it lowers your stress hormones. It decreases your perception of stress, and it actually lowers your blood pressure, strengthening your endothelium, that special lining of the vessels of the heart. And so I go through this and many other aspects of how getting selfish, that first S, is so important. Mm-hmm. Now, the E, I talk about two phrases. One is exercising belief. Right? And so I always tell patients that what happens when I have a brand new medication? Well, I review the science with you and I tell you that this medication was compared to what? A placebo.
Placebo. Yep.
So, what is a placebo? Placebo is a sugar filled, in other words, an inorganic substance that has no biological activity. And so, what they're comparing this medication to is the power of belief, the power of your mind, and seeing that can this medication beat out your mind?
Mm-hmm.
So we understand that belief is so important and that you have to understand that you're worth it, that you believe in yourself,
Mm-hmm.
that you have the resources to move forward. But not just that, but also exercise of just movement. And that we understand you don't have to go on a date with Peloton. You don't have to do it with, for those of us older, Billy Blanks and Tybo and other things like that, or Jane Fonda aerobics. You can simply walk. You can
Yeah.
stand. You can move around. And so that's the power of exercise, really, for decreasing stress, especially in nature, especially simply with sunlight and healing the broken heart, lowering blood pressure, improving diabetes, etc. So I go through all of that.
Mm-hmm.
The L is my favorite one. Love. Love. Not just because I'm a heart doctor, right? So L stands for love, and love, we think of love as a noun, Romeo and Juliet. But love
Mm-hmm.
is a verb, it's an action. So
Mm.
forgiveness and gratitude and volunteering, the fruits of love. And so when we look at those, science has begun to tell us about the power of forgiveness, not only in terms of decreasing stress, but actually improving blood flow to the heart muscle in some small studies. The power of gratitude for lowering blood pressure, extending life,
Mm-hmm.
volunteering likewise. And so I go through those components and how they help with stress and obviously healing the heart. Food, the F stands for food, real food, whole food, food
Mm-hmm.
that enriches and nourishes the soul. And we understand that. And we'll talk about that ad nauseum there. The I stands for the intimacy of relationships, the ability to get vulnerable. And I always ask patients, I would ask them, do you have someone that you can get completely vulnerable with, that you can lower that wall? And it's okay for you to be that nerd. It's okay for you to be that dorky person. It's okay for you to have any sense and feel completely safe. That the power of having community, the power of intimate relationships that generates the oxytocin, which is the antithesis of the stress hormone cascade that helps dilate the vessels and heal the heart, is powerful. So talk through that too as
Yeah.
well. The S stands for sleep, rest, vacation. Obviously goes without saying. And the H, final H, stands for humor, for the joy of life, for laughter, for smiling, and just the power that that has in emanating your
Mm.
soul, your being, and decreasing your stress and really helping your heart.
So much of this is what some of us might think of as soft skills, you know,
Yes.
like but they really are what makes the difference between, surviving and loving our lives in many cases. So the fact that humor or self-care or love don't just, make things feel better, they actually make things get better is, I think, quite fascinating. And of course, you're backing this up with science,
Yes.
showing how faith and belief are so important. And when you can harness all of this, you not only add years to your life and life to your years, but you add more joy to those years and more meaning
Yes.
and more fulfillment, which I think is quite profound. You're a cardiologist, so you're working with people's physical hearts. But do you think do you ever ponder how we also have this Valentine's Day kind of hearts, heart emojis that are like, it's about love? What's the relationship here between the thing that beats in our chest over here and that feeling of love between people? Is it directly related, or is it just kind of chance that we use the same word?
Well, I think it is directly related in a sense, right? So when you start to look at the different types of love as described by the Greeks, the ancient Greeks, you have agape love, which is just this philosophical love that's open to everyone, right?
Hmm.
Then you have storge, and you have, which is more of like for families. You have philia, which is like Philadelphia, the root, and so forth, brotherly love, and then you have eros too as
Hmm.
well. And so as you begin to learn and you look at the evolution and the research behind it of how you start to activate with dopamine and you start to go with the norepinephrine that causes the pitter patter inside your heart. The dopamine causes that drive, that longing for a situation or circumstances, the serotonin causing that longing. And so when you mix all those together, it's not surprising that we feel this in our chests.
Hmm.
We start to feel the butterflies in our chest, and we automatically emanate and reflect on this as being the state of our emotions. Whereas there's a distinct interconnection between our stomach, our heart, and our brain in
Hmm.
terms of the hormone cascade that's there. And so as I looked at this over the years, I didn't start out this way, but I'll tell you what started triggering was the fact that I started seeing more and more stress related to events coming into the hospital. I wasn't trained on Takotsubo or broken heart syndrome. And I started seeing more and more instances of it. And I started doing more research about how stress, and going back studies from when I was in training, but I wasn't taught about it, wasn't exposed to it, about how stress is paramount to the other risk factors, stress
Yeah.
at work, stress at home. And you start looking at all these things and where we hold this in our body. And even myself, Ocean, I'll tell you, I'm not immune to it. So I have to get selfish almost daily because I'm not immune to the symptoms of stress. And so when I feel overly stressed, I feel it right here, literally. I feel it in my chest. That's right there. I feel it in my neck and in my back, and others may be able to relate to that. But those are things that we feel. And the interesting part is when I'm completely relaxed, all of a sudden I sleep like a baby. All of a sudden I don't have any neck pain and I'm breathing well and no issues whatsoever. So,
Yes, thank you. Um, I'm curious. There was some research that came out in May of 2024 on the impact of frequent angry outbursts on risk of heart disease.
yeah.
Researchers found that feelings of anger could increase a person's risk of developing heart disease by limiting blood vessels' ability to open. And we also have research indicating that somebody who has an angry outburst is more likely to have a heart attack in the ensuing hours, even minutes. What's going on here, and why does it matter?
Oh, it matters so much. So this is all related to the syndrome of stress. And so the stress hormone cascade that really just triggers what happens when we get stressed. Our sympathetic nervous system goes into overdrive, into action. And so our blood vessels begin to crimp down, right? They constrict, increasing the blood pressure instantly. Our heart rate begins to beat faster, causing that sensation of our heart beating in our chest and increasing cardiac output in our stroke volume. Our liver begins to produce gluconeogenesis, to feed the muscles, all priming us to run or to run away, to fight or to run away. But
Yeah.
instead, we're there in this constant state. So we're flooding our system with this instability. But really, what science has begun to show, and there was an article in the Journal of American College of Cardiology, several that elucidated the same information, that where our fear and anxiety is housed is in a small portion of our heart in the limbic system called the amygdala. And this amygdala actually begins to turn the key of the engine of stress. So every time we recognize a situation that triggers the anger because of frustration, we recognize a facial expression. We recognize someone who looks like someone who did us harm. And these things begin to trigger the same sense in us that we now have repeated bouts.
Mm.
And so what this study told us is that it brings about a cascade of neuroinflammation that goes through the bone marrow, then to the blood vessels, that then triggers what we call destabilization of plaque. That means the atherosclerosis, the hardening of the vessels, become unstable. And now they're prone towards developing clot and subsequently heart attacks that happen.
Mm.
So not only that as a mechanism, we know that that acute burst in stress, it causes the platelets to become stickier. Not only that, we understand that this acute bouts of stress or from anger, right? We're talking about anger and frustration.
Mm-hmm.
This causes the paralysis of the heart muscle. So the heart no longer squeezes inwardly, it squeezes outwardly. And that's what we call apical ballooning syndrome, Takotsubo, or broken heart syndrome. So there is such a robust amount of growing data about the perils of living in this constantly stressed state filled with anger and resentment. And I'll tell you one other area, because when we think of anger, what comes to your mind? You think of getting angry at someone else.
Right.
We don't realize that we harbor so much anger and ill content against ourselves
Well,
that we
that's
have to
kind of a
learn
twofer,
self
isn't
forgiveness.
it? It's kind of a
It
twofer.
is.
You're both getting the negative effects of being the angry one, and you're also getting the negative effects of having that anger directed at yourself.
That's right.
Yeah.
That's right. That's why forgiveness is so important. That's why
Mhm.
forgiveness is a sort of superpower that we have to forgive ourselves and forgive others. It doesn't mean that whatever harm they did doesn't need correction, but what it means is that you're letting go of
Mhm.
it. And that's something I'll be honest, I have to tell myself. We talk about these things sometimes, but it doesn't mean that we're exempt to them, the same processes or issues.
Sure, sure. Well, a lot of folks might be thinking, okay, this is a great conversation to have with my therapist, but why would I be talking about this with my cardiologist? What does he know? They didn't teach in medical school how to bring down stress, certainly. But essentially, if you care about people's hearts and you care about their well-being and you care about their survival, uh, then you have to look at this stuff, right? Which I
That's
think one of the cool things about a medical approach is that you're coming at it from a very data-driven perspective. Therapy is very rarely data-driven. It's usually a whole other body of work. But when we think about data, we can start to get actually practical about, well, what works? If we
yeah.
want to bring down anger, you know, what's the key? Do you stuff your feelings and grow a tumor instead? How do you work with that to actually have a healthy physiological outcome? Because I think a lot of us have dealt with anger by going numb or shutting things down and just kind of feeling more tense, and that isn't really what we're going for. So what is the positive solution?
Yeah. And I'll tell you, if I can simplify it, I really believe that it's not about removing these triggers for us, that we are never going to encounter stressors that elicit anger and everything else. That's what led to my belief of the equation of health equals resiliency divided by stress,
Mm-hmm.
that we have to focus on building our resiliency. So let's tease that out a bit. So when we're angry and we're frustrated, we come home from wherever the situation is, oftentimes we want to go into isolation. Nowadays, maybe with our phone, maybe sitting down, people may turn to alcohol, may turn to television and silence. Studies have shown that actually does not lower the stress or the recurrence of events. It's actually engaging with people with similar types of events and being able to convey that. This is where the intimacy, where the community comes into play, about having someone that you're able to communicate with that can actually lower that stress level that's inside of you, that perceived stress, that cortisol that traces through your body that has been associated with increased disease, that lowering that is profoundly beneficial. We understand that this is the beauty of selfish, is that each of the pillars actually they work and they feed into each other. So
Mm-hmm.
when we engage in mindfulness or yoga, if I'm honest, the other day I had very challenging 4.5 hour case, and thankfully the person did well and they made it off, but I was stressed. Even my aura ring told me I was stressed, right? During that period
Yep.
of
Yep.
time. I came home tense. And so what did I do? I went and I decided I was going to engage in doing some yoga, some deep
Mm-hmm.
breaths,
Mm-hmm.
and so forth. I wasn't going to try and do Peloton or treadmill or run or
Mm-hmm.
weights. I
Mm-hmm.
did that to relax. I
Yeah.
felt better in that moment.
Yeah. There are so many things that can bring down stress for different people, right? I mean, some people have hot and cold showers. Some people do yoga. Some people do deep breathing. Some people do meditation. For other people, meditation is going to be terrible. Their mind's going to be worrying with all the things they're mad about. So, like, find some people do go for a walk or a run or call a friend or the list goes on and on, right? Of wonderful tools, and the key thing is to find what works for you. I know personally, I'm finding breath to be more and more significant. That, like, I carry my breath with me everywhere I go. I'm always breathing. And how I
That's right.
breathe is always sending signals to my body of whether I'm
Yes.
in danger, at peace, in fight or flight, in terror. And so, there's times when a very calm breath can actually be settling to my nervous system. And there's
Yes.
times when deep breaths can be settling. And there's times when deep breaths combined with holds at top and bottom can
Mhm.
help my body to re-regulate in a way where it's a lot of it is the attention for me.
Yes.
What are your favorite
Yes.
ways you just mentioned a couple, what are your favorite ways to dial down stress?
Yeah, I will tell you, I have found increasingly, and I'll be honest, ever since I started researching this, just like you, breath work has been so
Mm-hmm.
powerful for me.
Mm-hmm.
And it's the easiest to do where no one knows exactly what I'm doing. Doesn't seem like I'm being strange. And I'm having a few moments that really resets me. And it's extremely powerful. That's powerful for me. I'll tell you the other thing that tends to work in it almost settles down a busy day
Hmm.
is when I stop, and I talk about this in the book under the last section on how to really enact all of this, is when I go in and I plan, I put pen to paper and actually write down what I'm doing for that day. And when I actually can see it, and as I move through it, for me as an individual, that's calming. I
Yeah.
feel as if number one, I've accomplished things,
Yeah.
and then two, I set like minimal things that I'm sure I can accomplish.
Yeah.
That is so settling for me. It really is.
Me too. And I actually need a pen and paper to make it work. It triggers
Yes.
something different. If it's electronic, it's stressful. But if it's right in front of
Yes.
me and I assign like how long I think it's going to take to do some of those different things.
Mhm.
And I make sure that they're small enough bite-sized chunks that I get to cross things off quite a few times per
Yes.
day. Even so I break it down into little pieces because I love that dopamine hit that says I made progress on something that
Yes.
matters to me. And you can do the same thing in any area that matters to you. By the way, it could be about you can do that in the kitchen. It doesn't just have to be a desk job. It can be about your relationship. Like, tell my partner three things that I love about them today,
Yes.
and then brainstorm like three quick things you're going to cover, and then you come back and do it, and then you get to cross it off. I did it. All these things
That's
can be helpful. Keeping a gratitude journal. There's a lot of ways you can use lists to track progress and results. But
right.
make sure they're small enough chunks and they're doable. Because what happens when you create goals that you don't meet is that you actually recreate negative grooves that say, I'm not a person who follows through. I don't do the things I say I'm going to do. And that lack of accountability leads to negative self talk that can be super detrimental. So you want to flip the script on that by making sure the goals are accomplishable and then getting that pleasure. Um, Columbus, I want to ask you about loneliness, because
Yeah.
we, a lot of people today, deep down in their heart of hearts, feel some degree of loneliness, whether it's deep, aching longing or a little feeling of dissatisfaction or disconnection. Um, and we now have research telling us that loneliness is linked to increased risk of heart attacks and
Yeah.
shortened life expectancy. Are you seeing this clinically? And what can people do to strengthen community and relationships?
Gosh, it's such an important issue. It's such an important issue as we've grown as a society and technology and so forth. But I'll share with you something that when I was in local leadership for a while, they had us do this enactment to pretend as if we're like a city community. And I was like, I don't need to do this to figure out about like what disparities are like or suffering. But I went ahead and played along because I had to. I was a leader.
Mm-hmm.
And for one instance, I was given the task of being an elderly person who was living alone. And I'll tell you, even though I consciously knew this was fake, the way they constructed the scenario, I felt alone. I felt lonely. I felt as if I was stressed about every situation, about uncertain about what was around the corner. And so what I'll tell you is that loneliness is indeed a form of a stressor. And we become disconnected as a society. No longer do we have generations that live with us on average. When you look back at the Rosetto and other communities where they had generations that lived, it seemed to be very protective as it relates to heart health. We look to the blue zones very similarly, a very protective nature when you have generations that are there living and thriving together. And so it's hard sometimes to make that connection, to be honest with you. And so one of the things that I realized as a clinician was I had patients coming to see me and I wondered why were they coming back? They were doing okay until I realized I'm their community.
Mm.
I'm their touch home, like tag, I'm home. Okay, I can go back out into the world and they can release and let things go. We have to find trusted individuals. And what that means is you have to make yourself available to others.
Mm-hmm.
And oftentimes I would say, if I'm not receptive, if I don't appear open to others, I can't blame them if they're not coming to me or we're not connecting. And so making yourself available inside of small settings as much as possible, just one person saying hello could be an easy start. Putting yourself in situations where you're able to make connections is extremely important, whether or not that's inside places of faith, whether or not that's inside of organizations or clubs, or I'll tell you an easy way where you're almost, I hate to use the word, where you can actually tackle two tasks at once.
Mm-hmm.
Volunteer. When you volunteer, my mother is going to be 89. She always looks at me crazy when I tell her age, and she's doing wonderfully. She volunteers and volunteered for years. Through volunteering, she makes connections with new individuals.
Mm-hmm.
That she's able to find individuals with shared interests, shared beliefs, taking classes, things of that nature. That's how she's able to build her community, right? As she's grown older and left others have left her from this earth, she's grown by playing the ukulele. That stimulates her reading, the ears, auditory, and her frontal cortex. That when she goes and she paints rocks and does gardening or volunteers in the hospital, all these things give her exposure
Yeah.
to help decrease that loneliness.
Wow, beautiful. Yeah, so we can actually build a sense of connection and kinship, not just with other humans. Of
That's
course,
right.
with
That's right.
animals, often
Yes.
people feel very real love and bonding. That's not just sort of placebo. That's very real, Um, but also with nature, with our own sense of
Yes.
purpose, with music, with joy. So there's a lot that can make the heart swell. And even with ourselves, I will say, like
Yeah.
self-love is a form of communion. It's a form of connection. Now, I want to just touch a little more since we're sort of we're touching on it, but I want to go more directly to the first letter in selfish,
Yeah.
spirituality. Now, of course, there's a lot of different faith traditions in the world today, and some of them get very combative with each other. Um,
Yeah.
but in essence, what are the benefits of having a healthy relationship to spirituality, and how do you define that term, and can that include people who do not belong to a faith tradition per se?
Yeah, no, no, there is. And so that's what I alluded to at the beginning. So there are components, whether or not, obviously, there's the aspects of prayer and meditation. And prayer is more of an active petitioning to a higher being, whereas meditation is a calming, it's a settling down, it's more of a listening appreciation that can happen in nature a lot of times, where there's this sense of calm that comes over as you're just allowing your mind and your body to rest and to pause and
Hmm.
to stop in those moments in this fast-paced world. And that is so reinvigorating to the body and mind. And so when we look at this, one of the interesting things, and there was a small study that looked at faith-based meditation versus what they characterize as secular-based meditation. And the faith-based meditation was saying essentially that there is a higher power and a God. The secular was more of, I am enough, and just kind of meditating on that. And what they found, they did interesting experiments of putting hands in ice water in terms of measuring stress hormones. And they found that those who found resiliency,
Hmm.
greater resiliency inside of a belief that there is an additional level of support there for them in this higher power, seem to be able to tolerate the pain, seem to be able to have lower stress hormone cascades. There's another concept a colleague of mine we or he put together more so this component, which is stress equals demands minus resources. And we oftentimes turn to fake resources, but when we recognize that that resource may be in the higher power, that may
Hmm.
be in terms of some of the things that we're able to do, it helps us offset the demands, which obviously lowers the stress that we have. And so there's power that's there. And so there's been numerous research studies to really look specifically at this as it relates to, once again, blood pressure. And you mentioned this before, Ocean, which is the lining of the vessels, the endothelium, allowing them to respond faster. And that can be checked easily by what's called a flow mediated dilatation, where we basically inflate a blood pressure cuff and we use an ultrasound and look at how distensible or how responsive the artery is. And the
Hmm.
more responsive it is, the healthier it is. It tells us the endothelium is working well. And so these studies have really intimated a number of different things from carotid intermedial thickness, a marker of atherosclerosis, to the health of that lining there. So there is growing science.
Hmm.
May not be exactly cause and effect. It may be multifactorial, but it's a secret ingredient.
Yeah, thank you. Um, I want to ask you a question on behalf of a friend of mine. So she's um, recently had a small heart attack. I don't know if there's ever such a thing as a small one, but that is to say, she didn't almost die, and she's okay. But she had to have a stent put in.
Mhm.
She has high LDL cholesterol, and she's being told by one of her healthcare providers that in itself can be misleading, and she should be all fine now. She's been plant-based for a long time, but she does eat the coconut oil. Uh,
Yeah.
and we know that coconut oil can lead to higher LDL cholesterol. Um, and when I put these two things together, heart attack, high LDL cholesterol, I'm trying to say, look, get off the coconut oil, you know?
Yeah.
But of
Yeah.
course, sometimes our close loved ones don't listen to us. But I'm imagining this is a concern that other people face too. And I'm just curious how you, as a cardiologist, would approach something like that. And are there situations where LDL cholesterol isn't a concern, particularly in isolation from other factors?
No, that's a great question. And so when we look at cholesterol and the whole inflammation, which cholesterol is a component of that inflammatory process, I think one of the key things is I characterize cholesterol as going into a room and seeing a room of balls. You may see big balls, medium-sized balls, golf balls, and baseballs. Obviously, the golf balls and baseballs will cause the most harm. They're the ones that can penetrate and lead to major damage. So we know that the smaller subfraction components are the ones that are what we call atherogenic, which means they're more inclined to cause atherosclerosis.
Mm-hmm.
In general terms, for individuals who suffered heart attacks, well, even if we identify there's lots of balls in the room, we become concerned that
Mm-hmm.
if you've had an event, it's suggestive that there was a trigger, and it most likely is that trigger is from part of that high cholesterol.
Mm-hmm.
Now, there's two aspects. Depending on how high that cholesterol is, it may be familial, which means there's a genetic component, which
Mm-hmm.
means your body may produce a certain amount, and so having that exposure on a constant basis is just very paramount to saying, I'm going to be exposed to, I'll use an example, irrespective of a person's belief in this, it shouldn't be belief, but exposed to an infectious agent that's
Mm-hmm.
there. If I'm in a room without ventilation and someone is hacking around me and I'm there for a prolonged period of time, it increases my exposure, the
Mm-hmm.
likelihood I may succumb to it. If
Yeah.
I walk in, I walk out, my exposure is very transient.
Mm-hmm.
So same thing, the longer I'm exposed to the high cholesterol, the inflammatory products, the
Mm-hmm.
greater my chance is of having some cardiovascular event. So one of the first things I would do for someone where they were questioning about that, I'm going to check additional components. I'm going to check their small dense LDL, perhaps their lipoprotein A, maybe their C-reactive protein, maybe their apoprotein B. Not all in sequence, but maybe one or two of those to
Mm-hmm.
add to my concerns. Now,
Mm-hmm.
some may argue with me, my colleagues, and say, well, Columbus, you don't have to worry about that because he or she has had a heart attack.
Mm-hmm.
They should be on a statin. But I may have some patients say, well, listen, I do everything else right. I don't know if I want to be on that.
Mm-hmm.
Okay, well then fine. Let's look at everything in whole.
Mm-hmm.
Now that gives me guidance to say, well, what can we change additionally from your diet?
Mm-hmm.
What else may be increasing this potentially? And what can we do to offset it? So that's my more medical
Mm-hmm.
approach that I take.
Mm-hmm.
And in situations where someone hasn't had a heart attack, I may actually consider incorporation of a calcium score in
Mm-hmm.
there from a cardiac CT, which is very low risk in terms of radiation, but can give information about the risk or burden of atherosclerosis present.
Right. Is there calcium buildup in the arteries, hardening
That's right.
hardening of the arteries, essentially, which then leads to
Yes.
narrowing, which then is what we're talking about here, can lead to all sorts of cardiovascular problems. I want to get now to some of the questions from our Whole Life Club membership community. And
Okay.
again, I will say, folks, this is not medical advice. We're giving coaching and our own best insights, but of course, consult with a qualified healthcare professional about your specific needs. That said, let's go ahead and see if we can offer some coaching or feedback. Elsie said, thank you for your time and expertise. I'm 75, vegan, female, and basically healthy, but I'm dizzy with balance issues daily. Could my heart be causing this? The dizzying seems to be connected to my heartbeat.
Mm. No, that's a great question. And so I think one of the first things is this is something you definitely want to check in with your provider about to make sure that your heart rate is not too slow. That may be causing a symptom in which you feel unsteady on your feet. Unsteadiness can be caused by multiple factors. The heart is one of them. Sometimes it can be the nerves inside the legs. And so that may be another consideration to be given to as well. So a lot of times, once again, not giving health advice, but there's a great tool that is FDA approved called the Alive Core, which is wonderful. I recommend that in the community to my patient, to individuals who are not my patients. I recommend that to my patients as well. An easy tool that allows you to check your heart rate and actually send it to your provider when you're having symptoms there. But I would check with your provider first and foremost.
Got it. Thank you. Beth said, most people understand that consuming sugar can cause diabetes. Diabetes doesn't run in my family, so my family members think they can drink soft drinks and eat cookies every day. Heart disease does run in my family. Can you explain how sugar affects the vascular system so I can explain to my family why they should not consume so much sugar? Perhaps your explanation will influence them to eat a more whole foods plant-based diet like I do.
Yeah. So, I mean, I think the first step to kind of understand when it comes to sugar, right? Because some folks will get things confused when they talk about fruit. So, when we talk about sugar, we're talking about refined sugar typically and highly processed foods. And when we look at highly processed foods, the metabolism inside the body lends itself that the cells are no longer really quite able to uptake or to take in and store all of that excess glucose or blood or sugar that's there. So as a result of the inability and the hypothesis that's probably most prevalent right now is the fact of intramyocellular lipids, which means basically fat that clogs up and prevents insulin from opening the door, the key to open the door to allow the storage to happen. So now you're all dressed up with no place to go. Now this sugar is just coursing through your vessels on top of that lining called the endothelium. And what happens when we spill a sugary substance on the floor? It gets sticky, doesn't it? And it's hard to clean that up. Well, think
Mm-hmm.
of that same sort of damage occurring now throughout all your vasculature. And so now it's causing stickiness on your red blood cells, which we measure in the form of hemoglobin A1C to see what percent are being glycosylated or sugarized. And so as this number is persistent there, whether or not it's diabetes, but it also impacts the lining of the vessels, which lends itself over to a number of different vascular conditions. It could be stroke, it could be heart attacks, it could be the issue supplying the legs. But here's one key thing. Your heart is more than just the three vessels we tend to talk about. Your heart is like a forest. You walk up and you go to a forest, you see the beautiful forest. This is what cardiologists look at in general. We don't look at the network of roots beneath the surface. We don't explore how they intertwining, but you can understand that the disease affecting a tree can start in the roots. And so we call that microvascular disease. And so this excess blood sugar can impact that, can lend itself to a lot of different conditions. So that's probably part of the mechanism as to why we see this increased relationship between sugar consumption, processed foods, and increased cardiovascular events on top of diabetes, on top of cancer, mortality, hypertension, et cetera, et cetera.
Fascinating. Thank you. Um, LaShawn said this question is for Dr. Batiste. I'm a 55-year-old African American female who was diagnosed with lupus 5 years ago. With heart disease being common in lupus patients, how would you recommend keeping my heart strong? I strength train twice a week and do cardio at least twice a week, in addition to being active at work. I'm planning to increase the cardio as well.
Yeah. No, well, one, thank you for sharing that your story and I empathize with you with this journey as you start out on this journey or you continue on this journey recognizing autoimmune disease. And autoimmune disease, surprisingly enough, is disproportionate inside of individuals of color, people of color. And we see this at high levels that are there. But what I can tell you in terms of encouraging you is that a lot of the same tools that I recommend in terms of nutrition for heart health also apply to lupus, myasthenia gravis, multiple sclerosis in terms of potentially maybe helping. And so there aren't as robust randomized trials and observational trials as it relates to autoimmune disease, but there are growing numbers of observational studies that tell us the fact that individuals who consume high levels of whole foods, of green leafy vegetables, of fruits rich in antioxidants, have seen some beneficial effects. And I can tell you, as it relates to preserving the heart health, we understand that there is extreme value, not only by dark green leafy vegetables, beetroots, for the dietary nitrates that lead to nitric oxide and that allow the restoration of the endothelium, that lining of the vessels. The fiber that's here helps decrease the bowel acids and helps move the cholesterol over and decrease the cholesterol as a result in decreasing cancer. That we know too as well that rich antioxidants that can help the decrease advanced glycation end products and oxidative stress. There's so much power that's there when you begin to incorporate though all the colors of the rainbow in the foods that we eat on a consistent basis. Focus every day on what you're eating for your health, right? And that's going to be a value for your system overall. Same for your heart as well as for your autoimmune.
Great. Thank you so much. Um, Jennifer said, I'm a 45-year-old wife and mother of two. I've been mostly vegan for 10 years, struggling to follow a whole foods plant-based diet. I love the food and love to cook, but my family, not so much. I feel so guilty serving myself more healthy foods than my family is willing to eat, and usually end up compromising with something in the middle, so I don't feel like I'm feeding myself better than my family. There are so many outside sources feeding them junk food, and I can't get them switched over to my way of eating. Any suggestions to help switch them over or to get over the guilt?
Yeah, several things, and so Osha, I'm gonna give my thoughts. I'd love to hear yours too as well.
Sure.
My approach when it comes to individuals who struggle, and I've been in your situation, is the fact that one is you have to number one prioritize yourself and stay consistent in the food that you're eating if you're on that path. And I understand that can be a challenge at times because of the fact that there's other influences inside the home. But I think that as you make small changes with your family and you incorporate the things that you focus on what they do like of that are whole foods. So whether or not it's, I always say the three S's, soups, smoothies, and salads, that those are easy ways that you can incorporate some fruits, maybe vegetables, and make it a nice treat for them, that it's healthy. I think that you're looking to begin to say, what's this relative to? So if I'm looking at, although I may advocate a whole food plant based diet, minimally processed, but if I'm looking at red meat compared to a processed plant based burger patty, I'll say, yeah, that's a good transition perhaps for them if they're not willing to. I always give the example. I was in New Orleans, I was at a large festival and driving around for literally hours, trying my best to convince my Uber driver to transition to a whole food plant based diet. And so he was just like, no, I use his son. He said, no, I'm not feeding my son this stuff. His wife, everyone. At the end of the conversation, all I was able to get him to do was to try a plant based burger. That's all. But I said, you know what? That door is cracked now. If I can get him to try and realize he doesn't have to give up his culture, who he is, because everything is about taste and about flavor and about culture. And recognizing that you can maintain all those things no matter what your culture is powerful. That's what I would encourage you.
Yeah, and I would add that there's no need to feel guilty for taking care of yourself. You know, there and if you're eating the food that is feels right to you, and your family is eating the food that feels right to them, it's very generous of you to be willing to try to nourish them in a way that feels like love to them, while also nourishing yourself in the way that feels like love to you. But if it feels like you're compromising on what you're not doing them any favors, honestly. It's easier, but it's not necessarily gonna. At the end of the day, your kids are gonna learn from your example, and your example includes your respect for their autonomy, and it also includes your respect for your autonomy, for your well-being. And you never know. I mean, I see people who grew up in a healthy eaters eating home, and they rebelled, and then 30 years later they get a diagnosis, and guess what? They know how to do it. They come back home. They ask their mom, hey, what is it you were taught me when I was a kid that I wouldn't listen to? I need to know now. So you never know. You're teaching by example. You're creating culture, and children are learning from that. So and the other piece I would say is sometimes there's ways to get creative with uh like a yes and food culture. For example, you make burritos or tacos and you have all the fixings out, and people add the things that they want to it. So then everyone has the same, there's the rice and there's the beans and there's the burrito wrapper, or there's the tacos shell or whatever, there's the guacamole. You all got that. And then some people put on the onions and other people put on the salsa. And then some folks are putting some other stuff on there, right? And then you got the tofu sour cream, and you create options. And then sometimes people are like, hey, I'll try that tofu sour cream. Let me see what that tastes like, and you just never know what's gonna open up for people. But creating opportunities for people. They can have you can have the spaghetti, and if somebody really wants to have some meat on their spaghetti, let them add it on the side, right? But then everybody can have a base that works for everyone, right? So those are just some things that could be helpful. But most of all, just know that your family wants you to be well. And if they don't feel threatened, like you're trying to cram an ideology down their throats, they'll probably be a lot more spacious to be able to actually honor you for doing what feels good to you. And hopefully you'll be around longer because of it. And they'll see that. And they'll be really glad that they have you in their lives long term. Colleen said, what's the best way to get an accurate blood pressure in a doctor's office? She's telling us that she often gets so stressed with a blood pressure test that her blood pressure goes way up. So how can is that right? Should the cuff be that tight? And she's wondering if a wrist monitor is accurate.
No, that's a great question. So multiple prongs to it. First of all, I would say maybe get to your doctor's office 5 minutes before you go in just to rest and relax. Go in, they're going to bring you in, they're going to check your blood pressure. Use the breathing techniques that Osha and I have spoken about. Just take nice, slow, deep breaths in and out. I'll tell you, I was in a community event and I measured a young lady. She was in her 70s. Her blood pressure, it was extremely high. I said, okay, I want to walk you through a routine. I said, I want you to picture yourself in your favorite vacation spot. Close your eyes, take nice, deep breaths. And we did this routine for only about a minute. Rechecked her blood pressure. It came down in her instance, 20 points. Now, I'm not always saying that it will come down that much, but do that. The second thing I would tell you is that whenever your blood pressure is elevated in the provider's office, ask them to check it again, perhaps towards the tail end. To recheck it which should be the normal process. But sometimes in a rush, we don't do that. The third thing I would the next thing I would tell you is that you're correct. There is an appropriate cuff size according to your arm diameter. And so it is important that providers are using the correct cuff size. But I will tell you that the traditional arm cuff is going to be more accurate than the wrist blood pressure machine. And so that's where those are the sequence of advices that I would give to you. But I think it's a reflection when I tell people although we characterize as white coat syndrome, it's a level of your body's response to stress. Right? It's telling us that your body is responding to stress with an elevated blood pressure. So the question is, how are we able to deal with this stress? And that's why I think the breathing technique becomes important. I think kind of planning, okay, I'm going to get there. I'm going to relax. I'm not, and kind of go from there. Remembering that doctor works for you. You don't work for the doctor. All right. And you change the dynamics of the visit, and your mind can be powerful.
Thank you. Ida said, I'm a 60-year-old woman with cerebral palsy. I get rather frustrated when I hear that a sedentary lifestyle could lead to heart attack and stroke. I cannot vigorously exercise, but I can do some breath work and stretching with assistance. Is this enough to lower my blood pressure, or should I consider getting on blood pressure medication?
So I appreciate you sharing your story. And you're right. I think from a standpoint, everyone's circumstances are different, whether or not their resources, their physical ability. And so I think one of the key components what studies have told us, it's not that vigorous activity that is the most life-saving. To be honest with you, marathon running is not necessarily conducive for heart health, but actually it's just that subtle movements that are extremely important. We understand the power of stretching is extremely beneficial. If your blood pressure is high, apart from your level of activity, we do understand the importance of lowering that blood pressure, right? And that becomes important working with your provider and looking at what those numbers are so you can increase the optimal time period that you do not succumb to cardiovascular events. But we understand the power of nutrition and lowering the blood pressure, the DASH diet, the Mediterranean diet, many other works that have aggregated patients who have adopted a plant-based diet or a plant-forward diet have shown a marked decrease in blood pressure readings, which is powerful. That's there. And relaxing the blood vessels using through the same mechanism that we use for medications. So there is power that you still have in your tool belt, right? That you can enact that we know that by getting good sleep can actually lower the blood pressure, that making sure you don't have sleep apnea is extremely powerful. We understand that by laughter, what we talked about can actually kind of help in small incremental numbers too as well. So there are multiple facets of things that you're still able to grab hold of and do that can be powerful in your journey.
Thank you. I know we have just a little more time, but we've got a few more questions I'd love to get to if we can. Three more.
All
Victoria
right.
said, could you clarify the role of estrogen in preventing heart disease in postmenopausal women? Do you recommend estrogen replacement? And what about the dangers of developing breast cancer?
Yeah, so generally we don't. We understand that losing the estrogen is appears to be a major issue for women in the postmenopausal state. We understand that all the things we've spoken about today can actually be extremely enriching for postmenopausal women for reducing cardiovascular disease. The issue of giving estrogen is probably a little bit more complicated than what I can address fully here in a short time window. In general terms, we used to recommend it for everyone. We found that that was not beneficial. And we stopped doing that based upon studies. So it really will be individually dependent upon the burden of symptoms that you're having, as well as what your prior medical history is, merging those together to figure out what the best pathway is for you.
Got it. Thank you. So this sounds like a great spot for having a healthcare provider that you trust, that you can work with, because there's a lot of nuance to it. It's not a one size fits all situation. Um, Rio said, I'm 70 years old and have had lower lumbar decompression and fusion surgery 2 years ago. I'm in chronic pain every day, which seems to have affected my blood pressure, 145/90. Is there anything I should do to bring it into a normal range for me, which would be 130/80?
Yeah, I mean, that's a hard one because you're dealing with this chronic pain. And so I empathize with you with that back pain like you're having. And so I would encourage still getting in with your provider and figuring out, are there any type of therapeutic options for you as it relates to, stretching, other activities with physical therapy that may be able to partially help alleviate that pain, which invariably will help with the blood pressure. So your
Hmm.
blood pressure sounds like it's a symptom from an underlying cause, as opposed to it being an essential hypertensive state. So this is where that combined approach will be helpful with your providers.
And the other thing I would add is for those who are dealing with elevated blood pressure or any other, honestly, biomarker of cardiovascular problem, and are discussing the things you can't do. If you can't fulfill all the pillars of lifestyle medicine, let's suppose that you can't bring down the stress because your life is just super super stressful. Let's suppose that you can't exercise because you have cerebral palsy, or you're in constant pain from a back pain. Like, whatever the issues are, that just makes all the other pillars all the more important. So you do
Yes.
what you can with what you've got. So it's the breathing, it's the healthy diet, it's the spirituality or contemplative practice or whatever calms your mind or gives you a sense of greater purpose. It's love and connection. So you want to focus on all of the selfish elements that you can, all of the pillars that you can, and bring those into your life in the best ways that you can. And that's how you optimize. And not everybody can do well on all of them. Some people, there are people struggling with every aspect of that, but all of us can do something, you know,
Yes.
and that something hopefully will lead to more health and more wellness, which hopefully will open the door to be able to do more of the things that help us, because it should be a journey of continually evolving and growing to live our best lives and be our best selves. And in that light, last question here is from John, who said, I'm a 74-year-old Asian American on a very healthy path. Um, I'm grateful for this path that I'm on, knowing I possess the most important quality of life I could ever imagine, and that is priceless. I've lost so much and gained so much, namely my friends and family who do not agree and support this lifestyle. I want to share this with those who seek this type of joy and happiness, and to be able to connect with their hearts and to believe this way of life can work for them. That is my calling and my purpose, to connect with those who feel the same as I. How do I do that? I lead by example, make no judgment on others, and do the best I can to live my happy life. Thank you for any thoughts.
Oh, I love that. Thank you so much for sharing. I think that's powerful. And I think you really summarized it well. I think living your purpose is extremely important for all of us. That's what I seek to do every single day. It's not about perfection, but it's about being intentional. And I think as you begin to grow, putting yourself out there, I think is extremely important. So as you want to touch others, being willing to be used is important. Extending yourself, volunteering. And when you volunteer and put yourself inside of circumstances where people are able to see what you're doing, and then you can speak to it, you begin to grow. You begin to expand that network and your reach, and you're able to help more and more individuals. So I just encourage you to continue on this journey exactly as you're doing, and just expand out, set small goals. I'm going to help volunteer here where potentially my footprint can be a little bit larger.
Yes, thank you so much for that. And I just want to say, like, you know, congratulations for feeling lit up with a sense of purpose and living in a way that feels good to you and that lights you up. This is beautiful. And I happen to know that John is part of our plant-based coaching certification, so that's wonderful. I'm sure you'll be getting lots of good tools in there, John, to help you spread the good word and inspire more people. Columbus, I just want to thank you so much for your wisdom and your heart and your leadership and your book, Selfish, which is available wherever good books are sold. You can get your copy. Again, that's Selfish, A Cure for a Stressed and Broken Heart. And thank you so much for your incredible wisdom and partnership in this food revolution.
Thank you, Ocean. I appreciate so much being on with you and on this journey with you. Take care.
When it comes to cancer, Alzheimer's, diabetes, heart disease, and other chronic illness, what really matters isn't how many books you read, how many webinars you attend, or how much you know. What really matters at the end of the day is what you eat and how you live. The science has given us what we need to know. Now it's time for action. It's time to implement and optimize your healthy lifestyle. It's time to get results. It's time to say goodbye to confusion and hello to clarity. It's time to say goodbye to bad habits and hello to good ones. It's time to fall in love with foods that love you back. It's time to join a community that will support you in achieving your goals. It's time for Whole Life Club.